have a special guest. It's Dr. Zach, and he is an expert in active release technique. He's a chiropractic physician, an educator. He teaches anatomy courses. Tell us a little bit about your background, if you would, please.
Sure. So I've been fortunate now that I'm in my 25th year of practice. I started out at National College of Chiropractic. When I was a student, had some exposure to this course called active release techniques and kind of fell in love with it. And it's been part of my driving passion through my career. And I also teach for active release techniques again.
So you have been fortunate enough to be able to treat professional athletes. So tell us a little bit about that.
So I was only a few years into practice. And at that time, the Cleveland Browns had reached out to me due to the specialty treatments that I do. I was hired on as a consultant with the Browns. So I've done 3 different regimes with them. As with our team, there's been many regime changes, so I've been in and out, but I've had experience there. I've worked with NBA players, Major League Baseball players, pretty much every professional athlete out there I've dealt with. So I've been blessed to be able to enjoy that kind of career. It's been fun.
Well, let's talk about the history and the art of active release technique.
Sure. So active release techniques is what A.R.T stands for. It was developed by a man named Dr. Mike Leahy. This was just mid-'80s. Dr. Leahy himself, he was an athlete himself. He actually played basketball at the Air Force Academy.
Now we're talking my sport and yours as well.
Yeah. And through his training of engineering and aviation, he used a lot of those principles later on in life to come up with active release techniques. He was working on a sports diplomat, and some of his colleagues would say, hey, can you share some of this stuff you're doing here? And he did a 1-day full body course teaching about, at that time, later became known as active release techniques.
Talk about cumulative injury disorders and how that connects with ART.
Yeah, so cumulative injury disorders is something where it could be from either overuse, from active injuries, or sustained hypotension from postural syndromes. And when those things are happening, it creates a damage to the tissue, which leads to scarring and tightness. And we could show you a graphic to describe that. But the bottom line of it, Dr. J, would be this, like, to keep it simple is, as I tell patients, if you pictured a paintbrush and all the bristles, it would be free, right? If we took that paintbrush and we painted something and we didn't clean it out, the bristles would become hardened, right? That's an example, very easy example of how we could picture the texture and the tension of, in that case, the paintbrush being changed. That's kind of what happens with the muscles from overuse, from trauma, and from postural syndromes. It changes how it feels, it changes how it moves, and it ultimately has an effect on blood flow, which is oxygen. An easy way to think about that, but affects, in a sense, the muscles, the tendons, the bones, the blood vessels, the fascia, and the nerves. All that stuff kind of gets affected.
How do you go about diagnosing that kind of a problem?
We do that with our hands so that we could find the exact tissue involved. We want to be able to feel, is the tissue moving properly, or is it kind of adhered to its neighboring surrounding structures? When we can do that and we can kind of figure out, is it a tear to the tissue, is it an adhesion? Then we may be able to put a name on it, like it's a syndrome of carpal tunnel syndrome or tennis elbow, something like that, right?
Okay. How does the tissue, movement of the tissue, how does that all work? When you're looking at soft tissue, that's a whole different scenario.
There's depth to tissue, right? So it's not all about just put my hand on a thigh, for instance, and what do I feel? I may have to go through a couple different layers and understand, what am I feeling? Is it the muscle? Am I dealing more with a fascial limitation? Is there a nerve entrapment? So I think the biggest thing to this diagnosis that we're talking about really is incumbent upon your touch. And how we would treat it differently would be with, in our technique, getting the exact level of what's involved by depth of our hand. Like, so example, using our thumb, feel the tissue, push down to where it's got a restriction, or you feel a motion that's kind of adhered to its surrounding structure, right? We'll go right to that exact thing. And then what the basic system of active release techniques is shorten the particular muscle that you're on, apply attention to it longitudinally, and then lengthen that particular tissue to apply attention to it. And you know what we're trying to get accomplished there is to increase the circulation. And why that's important is, guess what's carried in the blood? Oxygen, right? So at the end of the game, we're trying to bring oxygen to it because we want to break up that fibrogen type stuff that's been going on, right?
Let's talk a minute about just a specific technique, because our average individual listening to this podcast is not going to be understanding how to do these things because they don't understand the proximity of the muscles and the, the origin, the insertion, and all that.
So let's use an example of, if I were to use my forearm, what we're trying to really do is we're trying to get a relative motion, right? Meaning we're trying to move a tissue in relation to its surrounding tissue. Okay, is what that means. And let's just say that we had a piece in my forearm that was tight. Okay, it didn't move properly, and I wanted to actually help to try to make that move. So if I have a little piece of tissue here that is not moving properly, it hurts. Okay, what I would be trying to do is use my thumb in this case to put it on the tissue, sink in my depth. I'm going to try to lay my hand flat. So as I just set it onto the tissue, and you can see that I have full surface contact back here at the pad of my thumb. That's going to make it so that it's comfortable for the patient. And then I can just use my hand and get my depth by pushing in first. I'm not even doing anything with tension. I'm not moving anything. I'm just going to sink into the tissue to get my depth to where I feel I want to be. Then I'm going to draw some tension along the muscle. So in this case, I'm going towards my elbow. So my thumb is in there. I'm going to put tension towards the elbow in this case. My hand, which will impact these little muscles here in the forearm, this is going to shorten it up. So I shorten the muscle, I put tension into it, and then I'll lengthen the muscle while I hold that tension. So I'm not continuing to push harder. I'm not continuing to compress more to the tissue, right? So I don't want to just go in and crush through everything and then just try to do my tension. That's not going to accomplish what you're looking for. I need to have the ability in my hands to get to the proper depth of where I want to go, and then blow tension longitudinally along the tissue, not compressive, but along it. When we do that, I'm now going to just lengthen the tissue underneath it. And that's why, you could say yourself, and whoever else had treatment, it shouldn't hurt. It shouldn't hurt because it's not compressive. You're literally trying to hold that tissue. If you could picture a tissue that should be sliding and moving past its neighbor. And when you have a situation where they're tied up and they're not moving, that's where we start to get problems. If we have a tissue that's not moving properly, it's going to ultimately lead to inflammation. Inflammation is going to lead to scarring. Scarring is going to lead to more tightness in the muscle. And it's a self-perpetuating cycle that continues to go. And that's why in the sports world, it's been effective.
Dr. Zach, this has been really enlightening, and you've really shared a lot. Is there anything you'd like to share in closing?
I think for the consumers out there and anybody that's struggling with pain, I think to do yourself a good service is always exhaust all conservative methods first, whether it be through nutritional, like Dr. J tries to focus into functional medicine, whether it be somebody like myself that specializes in soft tissue injuries or nerve entrapments. Don't give up on it.
How can people get in touch with you?
I'm out in Westlake, Ohio. I'm right by Crocker Park. You can find me on my website, which is ZachPerformanceHealth.com, which is just ZAK, ZachPerformanceHealth.com.